So I'll introduce you to Bryan. Bryan, you've had quite a tough road over the past 12 months. He lost 140 pounds, which is basically half of his entire body weight, and that wasn't because he wanted to. It was because his body wasn't working the way it should. On top of that, he had trouble eating, had trouble digesting his food. It resulted in not only the weight loss, but he had significant pain that was radiating down both of his legs. And you told me that there are many times that's a 9 out of 10 of pain, and that was constant. On top of that, I think you said because of the constant pain, you were unable to sleep, and
I couldn't sleep, like sometimes only 2 hours, and that didn't matter whether I was awake for 36 hours, then it was still maximum of a 2-hour time and not called sleep.
Yeah. So naturally with this, like I said, this started about 12 months ago. He went to how many practitioners, doctors did you see over the course?
If I recall right, I think I'm at about 8 or 9 currently.
Okay.
Over since this started.
And then they performed a lot of tests on you?
A lot of tests. We've done blood draws and checked for neuropathy and just trying to find something, and everything kept saying it was good, but my body says no.
Okay. And then they obviously tried different therapies on you, and you felt those weren't working for you.
Nothing has worked yet.
Okay.
Up until this point. So.
Yeah. So what happened next is another patient of ours, who's a friend of Bryan, had suggested he comes and sees us here at Longevity Medical Institute to try to find some answers. And we've done a lot of work on you over the past 1 week. I think we found those answers now of what's going on. And it's an interesting case because there wasn't one particular thing that you could point to and say, that's what you have. So he has multiple things. He has 2 things actually going on. And those 2 things together are really adding to what he is experiencing. So we're treating it from really 2 different perspectives. And Bryan's been here for a week now doing the IV therapies because he's got some the systemic issues of stem cells and exosomes and peptides, nutraceuticals. You've been doing the light therapy.
Oh, yeah.
You've been doing the physical therapy since you've been here. I won't go into too much of the case. I'm going to let Dr. Paras and Dr. Fergie, because they really get the credit for understanding you and what was going on with you and all the diagnostics and everything we did to get to a conclusion of what a diagnosis is. So maybe just tell us a little bit about like when you came here, how you were feeling, how you feel now a week later. Clearly we still have other things we're going to do, which we'll talk about today.
Yep.
But
yeah, when I come here, then still no solution and no idea. And my last anything that happened in the for my last doctors was that they did one more blood draw and looking for 5 or 7 different items in there, and when it came back good, then it was just pretty much it's in your head. And so from that point was very interesting. My friend who hadn't seen me all of a sudden saw me, and he was so appalled, and he's like, buddy, we need to get you some help, and helped me get here. And had a really good day getting here, but from that point everything revert back to the same, and it just so massive a pain, and it just moving all over, and to where it's not like all my legs are waist down, just massive pain to where no sleep, no rest, no to get it is just crazy amazing. To get even 4 to 5 hours worth of sleep was just. But even from then till now is like the light therapy and everything are working. Like even on the initial, then doing the peptides in my legs, then pain was so bad I could not feel, I never felt the needle pokes at all. Like and even right now, it's where I'm getting to where I could feel them in certain spots, but the main pain, then literally no feel a needle going in.
Yeah.
And then now it's getting to where there's a couple of spots, but the way I can tell it's changing is I feel the needle pokes into every one of them now. So
yeah.
It's now a changing, and it's like I feel improvement. Other people around me will probably see it faster than me, just because it's such a long road of me getting to this point and now getting better, but it's nothing short of amazing so far.
So we have a very important procedure that we're going to do today. That's called the intradiscal injection of the stem cells and exosomes. Because of that nerve pain, he does, in addition to another condition, he has degeneration in his lumbar spine. So we'll be doing that injection today into the L5-S1 region bilaterally to get to the root of where that pain and that inflammation is happening. We'll also do that in the L4, L5s bilaterally, and that's going to get to the source of where that degeneration is, help regenerate the neurologic damage that's happened, as well as some of the structural damage that's happened there over the years, in addition to treating the other systemic issues that he had, because I believe they discovered that it was the blood sugar issues over the years that was sort of you didn't know, and the blood sugar wreaked havoc on his neurologic system, and then when it compounded with the degeneration and then the viral component of it as well, and he's done from detoxes and all the peptides, and we've thrown a lot at you, and I can tell you look a lot better than you did when you showed up day one. On day one, he wouldn't be able to sit in this chair for more than 5 minutes.
Yep.
We all went to dinner one night, and in the beginning he couldn't eat. He would hardly eat. He'd have maybe a couple of bites of something, and he had indigestion, and he didn't feel good, and he kind of had to stop. And then last time I saw you were eating like a normal person.
Yes, I told Dr. Perez I feel like I was eating like a pig because I had 3 meals in one day, and that's unheard of in the last year.
Yeah. Well, you're in great hands. So today, like I said, Dr. Fergie and Dr. Press talk about it, but also joining them on our team is Dr. Ramos, who is an amazing radiologist and imaging doctor. So he'll be on we'll do it with a guided needle injection with the ultrasound. And Dr. Cicito, top anesthesiologist, so he's going to be there making sure everything's comfortable. And we're going to remeasure this again after we're done and
Oh yeah.
do a follow-up.
I can't wait.
Yeah.
Cannot wait.
All right, let's do it, buddy.
Thank you.
You got it.
When I first met Bryan, he was in a lot of pain. I think it was a really tough day that day. He was like all bending, in pain, shaking. You were a totally different person. Now I see you like happier. I don't know, something in you is different today.
Oh yeah.
And we've been doing a lot of treatments. We're really like boosting the whole system. And the first day I remember he gave me this pile of files, like it was like a Bible of files. And I spent the whole weekend just reading about it, trying to understand Bryan a little bit better. And we test for a few things. We test for like everything, pretty much everything, because there was a lot of things, but we didn't know what was causing the pain, that excruciating pain at the time. And so we test for Lyme diseases, for virus diseases, a lot of things. We check like glucose. We do another MRI, because in the past your doctors were saying that the level of pain that you were having, it wasn't explained by just like that injury in your back. It was really bad. It was really bad in pain. It was really excruciating pain. So we didn't understand what was that high level of pain. So we tried to understand the overall on Bryan's case, and at the end of the day, we discovered that he has some previous viral infections, and that was like exponential the pain, and plus a lot of inflammation, plus the neuropathy created by diabetes. And now we're trying to take that damage back with the stem cells, exosomes, peptides, nutraceuticals. So we're doing a lot of things right now to get you help a little bit, and a lot of injections, a lot of pain. We've been creating a lot of bruises all over, but it's all part of the journey, and you're being so nice and so patient, because this is not easy. This is not an easy journey, and you've been doing amazing.
Like I was telling Dr. Kirk even before, is that when the very first time getting the injections, the one leg, I never even felt like the pain was so bad that I never even felt them. And now that's how I tell I can getting better, because now it's starting to hurt.
Now you feel all my injections.
Now I can feel them all.
Yeah.
But yes, it's good.
You've been a really good patient.
I appreciate it.
Hello, we're here again with Mr. Bryan Barlow, one of VIP patients in LMI. Bryan is one of the most difficult cases as far as diagnosis and treatment we've had in the clinic. He's been suffering of a chronic condition for the last year. After different diagnostic tests, we came to the conclusion that what he was suffering from was the pressure of the nerves emerging from the lower part of the lumbar and sacral vertebra. He's been having treatment for 10 days now here in LMI. He has several infusions of peptides, stem cells, and exosomes. And on Saturday, we performed for the first time here in Cabo an intradiscal injection of stem cells and exosomes under ultrasonographic guidance. So, Bryan, after going through all these diagnostic tests and all these 10 days of treatment, intensive treatment, what's your impression of all those?
For me, it's kind of been nothing short of amazing for just each one. Is it I guess initial impression is it's finally getting an actual diagnosis, which we have not been able to do yet in the States. Everything always comes back to what looks like is normal, but it's still not normal. So having shown up here and doing, then yes, to find a diagnosis and to go after it's kind of amazing for me.
We all know neurological healing is slow process. How do you feel about your sensation in your lower limbs, the ability to walk, your balance, etc., after you've been having all this treatment in LMI?
So far it's very early doing it, but even immediately after the procedure, then my feeling, and it's still kind of staying the same, is that my toes mostly they just burn. If I walk anywhere, they burn. I can be standing on coals if I walk very far. And immediately after the procedure, the very first thing, whether it was the local or other, is the burning wasn't there. It was just a pain or it's a change. And any change is good. Like I have not experienced, like everything just stays the same, or the pain stays in the same spots, or, well, I guess it moves all over, but it stays in the lower limbs. But that, even for now, a couple of days into it, it's staying the same. We went for a walk or whatever today, and I didn't really get the burning sensation, and so that is a change that's pretty neat to me.
Okay. I know your appetite was practically suppressed in the last year because of the pain that made you lose 170 pounds, is that correct?
148 from peak.
Okay, right, 140 pounds. How are you now as far as your appetite, your nausea, your ability to feed yourself?
Like, so far, then, yeah, that, got hungry this morning and needed a breakfast sandwich, and so therefore I was willing to walk for it. And most people say walking distance, but walking distance is, walking distances here to there is a long ways for me, but walked to breakfast and actually ate the whole thing and kind of asked for a granola bar about the time I showed up here, so kind of getting hungry a little bit. So this is good. Scary, but good.
Okay, yeah, I witnessed that. Now, I would like to express my appreciation for your confidence here in our services in LMI. Last question. If you were to classify the quality of services in Longevity Medical Institute Cabo, and you had on a scale from 1 to 10, how much would you give it, honestly?
1 to 10 isn't a real live scale, because I'd probably rate it at 100 plus. Like, I have honestly not experienced the care that I've gotten here from the moment I stepped in the door. Like, I have not experienced, it's just a different level to where if we're gonna rate it 1 to 10, I'll say 10 plus.
Bryan, thank you so much for your confidence. We are honored to be part of that change that hopefully will be in your life from now on. We are excited to see what's the next step. So we'll keep you posted. Thank you so much.
Very excited. I'm very excited to go for this journey. Can't wait to be healthy again or feel healthy again.
There we go. Thank you.
Thank you.